All right, so I'm going to be your MC for the next hour or so, introducing you to some of the past challenges that ONC is focused on. I don't have any slides. Disappointment. So you just have to pay attention. I am also going to layer in as many FHIR puns as I can, as horrible as they may be, to the speaking engagement as I can. But the first intro part that I wanted to do is just keep you posted. Since you are in DC, welcome inside the bubble. We are working on a lot of things that are relevant to your work, and I wanted you to be aware of some specific elements of ONC's regulatory efforts underway that will be beneficial to your work overall, but also that we will appreciate your comments on as they come up. So the one thing to be aware of is about 2 years ago, the 21st Century Cures Act was passed. This was right at the end of the Obama administration, large bipartisan support for the bill. It included a number of provisions relative to CDC, FDA, NIH, and the like. It also included a section 4, relevant to ONC's work. So if you're familiar with the HITECH Act and the $2 billion that ONC got in 2009, we got our first round of statutory authority as a result of the HITECH Act, and then as part of the 21st Century Cures Act about 8 years later now, we have a new slate of authority. Congress has charged us to do new things, and so there are really two important provisions that are relevant to your work as app developers, innovators in the field that we're working on. And you may not have traditionally thought to engage with ONC in a way, especially related to our regulations, because you might think ONC regulates the health IT developers, the EHR developers, the ones that are providing those products out in the field to providers that need to get meaningful use incentives. This regulatory effort that Congress has asked us to engage in is entirely different. So the first slate of requirements that Congress asked us to take on are what are called conditions of certification. And these are applied at the health IT developer, the organization as a whole, their business practices. And so there are some related to what's called information blocking, and I'm going to touch on that in a bit. There's another one related to what's called real-world testing. So the health IT developers will have to demonstrate and provide real-world testing evidence of their products in the field. There's another one which will be of acute interest to everyone in the room. The health IT developers are required to publish APIs, I don't think I need to spell that out, that can be used without special effort, and I'll do the air quotes, for the people that are seeking to engage with those APIs. So this is the first entree for those of you that have never, you may be masters at JavaScript or, Java in general or some other, programming language, and never thought to interpret statutory language, but this is one of those first areas of statutory interpretation which is very easy to understand. What does special effort mean? What does without special effort mean? And so that's one of the things that we're going to be addressing in our regulatory proposals. And so the big update on the regulatory proposals is that, as many of you know, ONC is part of the Department of Health and Human Services, so we're part of the executive branch. As part of our clearance process for how regulations get out there in the public, we go through what's called the Office of Management and Budget. And when our rules get submitted to the Office of Management and Budget, that becomes public information. And so that happened about a week ago, where we submitted our rule for OMB review, and they have roughly 90 days is their usual customary process to review our regulation before it's published in the Federal Register. So at some point this fall, our proposed rule will go out that will explain many of these provisions around these conditions of certification for health IT developers. The other element which I touched on as well is around information blocking, and that's a kind of DC term that you may have heard of. You may refer to these practices as egregious pricing or other types of barriers to information exchange or unnecessarily withholding information without any good reason. Those are the complaints and critiques and criticisms that Congress heard leading up to the Cures Act's passage, and they instituted a new provision in the law related to what's called information blocking. My office is charged with creating what are called the exceptions. So Congress defined this behavior of information blocking. There's a definition for it, and it's a little bit legalese, but they kind of provided a broad description of all these practices that could be considered information blocking. And the enforcement aspect of it is that the HHS Office of the Inspector General, which is kind of our audit and evaluation folks over at HHS, they were given enforcement authority to provide penalties up to $1 million per violation if someone is practicing information blocking, for lack of better words. So in recognizing that the definition for information blocking could be overly broad and could include practices that are otherwise there in state law or in general public policy to protect patients' privacy and things of that nature, Congress charged us to create what are called exceptions, where it's okay to engage in a practice that would otherwise be seen as information blocking. And I know this gets really kind of legal, pretty quickly, but part of the regulatory work that we're doing as well is to say, what are those special circumstances in which it's okay to withhold information from being exchanged? So that's another area where your comments will be certainly appreciated, because the interest of Congress is that information is exchanged, and that there is only so many circumstances in which someone can say no, we don't think that the data should be exchanged. So in combination, there's a whole suite of what are called, again, in summary, conditions of certification that are applicable to health IT developers. They will, need to comply with them at the kind of corporate level, as I say in plain language. And then there's this component or complementary aspect of information blocking, which is another kind of enforcement paradigm that Congress has asked the department to take on. So both of these in tandem are really important to all of the work that you do, because a lot of the work that you do is powered by the data that you're able to get out of the source systems that you connect to via the services or other APIs that you provide. So when it comes to your civic engagement and your ability to influence policymaking in Washington, D.C., I wanted to call out the opportunity for you to comment on this proposed rule when it comes out. And we're going to be trying to have a much more engaged outreach to communities such as yours that come to these types of events where, normally you wouldn't think of commenting on a regulation, let alone, one that has been more traditionally focused on the bigger health IT developers, the EHR developers. This regulatory paradigm and set of proposals is really broadly applicable to the entire health IT industry, and I wanted to make sure that you're aware of those activities. So, special treat in terms of bringing back, reassembling the band. We've had a number of challenges through ONC focused on FHIR, so we're pretty hot for FHIR. And that's first horrible pun. Dating back to about 2016, where we started on some consumer health data aggregation related work, some provider user experience related work. We've done some around the security area. We've done others around kind of broader patient access as well. So throughout the morning here, we're going to be treated with some presentations from all these past winners from ONC Challenges in the past 2 to 3 years. I'll be doing the MC, kind of running up and down, introducing everybody. But that's going to be the next kind of hour's worth of content. Very much hope you are interested in the presentations that they provide. If you want other information about their work, other challenges that ONC has put on, we have information available on the healthit.gov website. That's also where you can sign up and be notified, as regulatory efforts and the like are underway or reach some level of publicity and maturity. So are we doing on time? Pretty good. So let's see. I'm going to come back later at the end and just keep you updated on 2 active challenges that we have going on, prize competitions. But without further ado, I'll call up Andrew. Is Andrew here yet? Is Andrew back there? All right, good. Come on. Andrew's going to present on, they participated asymmetric in our Secure Server Showdown Challenge. So one of the ideas that we had around FHIR is, they're servers. And one of the aspects around FHIR security is really understanding how to harden the FHIR servers to which apps are going to be connected. And so we ran a challenge contest, and Andrew's team won the server phase of designing a new server, and I'll let him talk about some of the stuff that's under the hood, but it's a novel code base in terms of a reference implementation compared to some of the ones that are available, otherwise were available today. So thank you very much.